of this disease. So if you see somebody who has been taking painkillers and rest and everything and not healing, first think of tuberculosis. This is so very common. Third, many times of meningitis or inflammation of the covering of the brain as well as the spinal cord also gives the first symptom only as back pain, nothing else. There are so many muscles which are around the spine, in the back. When these muscles goes into spasms, they also present with back pain. So you have to rule that out, that whether it is just a muscle spasm, it will be just a muscle spasm, commonest. And it is again because of posture or wrong thinking. You will be surprised to know that 60% of back pain that we see have got a functional element, or what we call as a psychosomatic or a psychological. People who are so stressed that the mind focuses or projects that pain onto some part of the back, and he goes on complaining of back pain. He is investigated so heavily, they take an MRI, different X-rays, so many other modalities of investigation, but you will see all of them coming normal, and he said that he is normal. But he says, doctor, you are not curing me. So this functional aspect has to be kept in mind. So these are few causes of back pain which I have ruled out. Apart from that, of course, there are so many. You will commonly see a failed back surgery syndrome. There are many patients who have been operated for wrong reason on the back, and when we find out the cause is totally different. So that person, he gets operated, he comes back with the pain of that operation added on to the original cause which he has got. So that is a failed back surgery syndrome. So you should keep in mind, and you see, before taking up any back surgery, you should at least have 2 to 3 consultations, not from orthopedic surgeons but from spine surgeons who specializes in these surgeries. Then and only then you take any decision for any surgeries to go ahead. As I have told you, listhesis is very common. Also, as we see sciatica usually in the lower back, we see sciatica same way in the neck. You know, somebody has got a habit of breaking his neck like this and like this. We strongly, refrain that person from breaking these habits, because they have got a very high chance of rupturing the disc over there, and they do not know. And they come and tell us that, you see, we do this and now we have got this pain which radiates in our hands. We know that he has ruptured the disc. The best treatment for that is to give him traction with a machine, or just make him lie down for a few days and he becomes all right. I think I have covered most of the things which is of interest to you, but if you have got any questions, I am over there to say. Yes, you see, the knee has got many muscles which we use very frequently, while the back do have muscles which, over a years and over time we are not using it. Now, for example, formerly people were riding horses to go from one place to another, and they would go from one town to another. Now, if you take a horse ride for about 1 hour, you will get severe back pain, because we are not used to doing it. So that is why it is better to protect. Suppose if somebody is doing exercises for back pain or just his back, that is the best thing to do. But if he is not used to doing it, and we are not manual laborers, so when you do it and suddenly you rupture this muscle or the ligament, and then the problem is too far-fetched. That is why it is better to learn, or always have a training in the mind as to how we should be behaving day in and day out, because we are not doing that kind of work which our forefathers were doing. That is why I have got a chart over here. I will be giving it to everybody, in which we have shown how to stand, how to sit. Suppose if you are sitting on a bench or working on a computer, it is a good idea that you should be sitting straight. Some people have got a habit that because of constraint of spaces, they have to sit like this, and then they get this back pain again and again. So these postures are very, very important. The first, as I said, the first cause is postural back pain. There are so many things which can just be corrected by correcting the posture, and you will not have back pain. And there are exercises demonstrated in that sheet, so you can go through these exercises and see which is most suited to you. And I recommend that everybody should do it at least for 5 minutes in the morning. the anything which is soft, it gets compressed. Okay, so these bones, as they become soft, they go into a compression. They suppose if the vertebra is this thick, as it becomes soft, it compresses. As it compresses, it spreads around the area. As suppose how people make thin sheets by hitting them again and again. When they compress, it compresses both the canal of the spinal cord as well as the canal from where the nerves come out and go into the hand or the legs. So both these canals are narrowed because of this osteoporotic compression. Sometimes you will be surprised that a person, suppose if he is quite elderly, about 80-85 years of age, he is doing nothing, he is sitting on a soft bed, and one or two vertebrae suddenly compresses and he gets excruciating pain which radiates down. So that vertebra is compressed because of this osteoporosis, and it has narrowed the canal. This osteoporosis, most of the time it narrows the canal in such a way that it is there in the childhood. The canal is like we call it trifoliate, means it's a very narrow triangle, and these people end up with a narrow triangle in that canal. We call it a trifoliate canal, and it again gives the same symptoms of this claudication. So osteoporosis is one of the primary causes of getting this lumbar canal and root canal stenosis in most of the races of the world. Especially, in equatorial countries they don't get so much, but in whites and now as we as Indians, especially because Indians have now, even got diabetes and all these things, and vitamin D deficiency. You will not believe that in the richest of houses, when we get ladies and we do their vitamin D level, the normal level should be at around 100, but their levels are only about 40 or 50 in the blood, and we have to pump large doses of vitamin D into them. And I always say that in US they have understood this very well. So they give vitamin D to girls the moment they start their menses at the age of 13 and 14, and they are asked to take till the time they live. So they have got fortified milk. The milk is enriched with vitamin D and calcium, which we don't have it over here, because they know that this process of canal stenosis and osteoporosis occurs in all old ages. So to prevent it, they do this. No, now since you have given an example of this carpal tunnel syndrome, so see, surgery is always done after seeing the extent of the disease. Now when we see that the nerve has degenerated to such an extent that we call it an axonopathy, that means the wires in the nerves are now dying off, and one of the symptoms is, or one of the signs is, that these muscles you can see on this side as well as this side, they are shriveling, they are getting atrophied. Then giving them conservative treatment is not correct. They should immediately be sent for surgery when there is a ligament, there is something known as a flexor ligament over here, that is to be cut off, and the carpal, the median nerve in that carpal tunnel has to be released. Because if you don't do it, all these muscles will be functionless within no time, within 2-3 months, then after that you will not be able to retrain them. So, yeah, immediately, because this is now very minor surgery. Likewise, there are so many other conditions, when we advise them for surgery in pains where these nerves are trapped, especially I told you C2, C3, then as I said, this lumbar canal and root canal stenosis, when it is very severe and patients are losing their muscle power. Patients don't realize, because there are a lot of muscles which take over, but we do a test known as EMG nerve conduction study, in which they actually quantify, they show that how many nerves or muscles are getting degenerated, and if the degeneration is too much, we immediately ask them for surgery, and they cut off half of the vertebra to release that spinal cord and the nerve.
Now see what he has got is basically known as ankylosing spondylitis. Now many patients, about 2% of people on earth have got this disease, It is basically genetically related. They have got something known as HLA-B27 which is positive. So as these people age, they become stoop like this. They become stoop because the ligaments which are supporting the spine or which keeps the spine in one level, those ligaments become hard, they become tough, and these people come into a stooping posture. When he must have become 30, 35, 40, he was like this, now he has become completely stoop. Now when these people, they do not have any compression of the spinal cord or nerve, that is why they do not have this claudication. So they don't, the basic problem is because of those ligaments, I'll name you the ligament, they are known as anterior and posterior longitudinal ligaments. These become toughened, but the nerves which are coming out from the holes, they are as open as ever. So that is why they can walk for long distances. Climbing and this thing will be alright. Yeah, walking will be a problem. See, sometimes when in olden days, most of the marriages or so many marriages were taking place within close family relations, in blood relations. So we see this, the couple same being getting the same kind of diseases and conditions. Sometimes we see that a particular area or a town, have got same diseases. That is this thing. People who are living in hill area, they get fluorosis because there is a lot of fluoride in the water which they drink. So they get hardened and brittle bones. So that is why we see all these conditions in them. Yeah, short people. There is no real. We do not have a specific solution to it unless until what happens that if one particular level of the vertebra is causing too much of a problem, then that part is released. But otherwise we don't interfere, because the primary concern of any spine surgeon is not to lose the stability of the spine. Suppose if somebody loses it, then when he walks, he will not be sure that where he is walking. He will need continuous support. So we don't interfere too much. Yeah, he can walk, or a walker, not otherwise.